Common disorders of growth in puberty. Autonomy. Queen Mary's Hospital for Children. Learning objectives, normal growth. Common growth disorders. Puberty. Common problems with puberty. Height velocity charts. Growth charts, son of Count Philip de Montbéliard 1759–1777. The ICP model of growth. Puberty. Childhood. Infancy. Height velocity chart for boys and girls in UK. Growth assessment. Building. Evidence. Growth assessment. The 6 blocks. History incorporated Red Book. Clinical examination. Measurement, anthropometry. Parental height. Bone age. Pubertal development. Common things first. Include a system check, look out for asthma, CF, celiac, IBD, psychosocial syndromes are rare. Growth assessment. History incorporated Red Book. Clinical examination. Measurement, anthropometry. Parental height. Bone age. Pubertal development. Anthropometry. Use every opportunity to measure height, not done often. Calibrated instrument. Proper positioning. Growth assessment. History incorporated Red Book. Clinical examination. Measurement, anthropometry. Parental height. Bone age. Pubertal development. Using parents' height, we can calculate a target range or 95% tolerance limit for their expected heights of their children. A. Father's height. B. Mother's height. C. A plus B. D. C divided by 2. E. D. 7 cm, mid-parental height. F. E plus / 8.5 cm equals target centile range. Using parents' height, we can calculate a target range or 95% tolerance limit for their expected heights of their children. A. Father's height. B. Mother's height. C. A plus B. D. C divided by 2. E. D plus 7 cm, mid-parental height. F. E plus / 10 cm equals target centile range. 91st, 9th centile. Growth assessment. History incorporated Red Book. Clinical examination. Measurement, anthropometry. Parental height. Bone age. Pubertal development. Bone age. Compare maturity of epiphyseal centers with standard growth better viewed in relationship to their physical maturity than chronological age. Possible to predict early versus late developers. Final adult stature. Advanced in girls. Does not make a diagnosis. Adds to the evidence. Done where indicated. If concerned, preferable to have BA done. Info included in ref if possible. Plus parental heights. Plus growth charts. Growth assessment. History incorporated Red Book. Clinical examination. Measurement, anthropometry. Parental height. Bone age. Pubertal development. Change from childhood to adulthood. Hormonal. Sexual maturation. Physical, body shape / image. Psychological. Emotional. Experimentation. Puberty. Pritter orchidometer. Also known as Pritter balls. Endocrine rosary. Growth, clinical problems. Short stature. Absolute height which is less than 2 sts per age, and/or a linear growth velocity consistently less than 1 sts per age. Significant SS is height less than 2.5 sts and height velocity less than 1.0 sts. Short stature, normal appearance. Short for parents. Looks normal. Normal growth velocity. Low growth velocity. Fat. Thin. Endocrine. Systemic causes. Systemic causes of short stature. CNS. Developmental. Cardiovascular. Heart disease. Respiratory. CF/asthma. GI. Celiac, IBD. Renal. CRF/RTA. Psychosocial. Emotional deprivation, anorexia. Often delayed skeletal maturation. Potential to catch up remains if underlying cause treated. Psychosocial SS. Psychosocial and emotional deprivation commonly recognized. Short stature, skeletal delay. Older children may experience delayed puberty. Endocrine dysfunction may be seen. Endocrine causes hypothyroidism, isolated GH deficiency. Multiple pituitary deficiency. GH-resistant states. Pseudohypoparathyroidism. Cushing's syndrome. SGA. Non-endocrine causes constitutional growth delay, Turner's syndrome. Skeletal dysplasias and bone disorders. Russell-Silver syndrome. Noonan syndrome. Neurofibromatosis. Constitutional growth delay. CDGP after 13 in girls and 14 in boys. Growth rate and bone age usually 2 st below. However, normal growth rate for bone age. Often a family history of delayed puberty, constitutional versus familial. Short stature, abnormal phenotype. Short for parents. Looks abnormal. Dysmorphic. Disproportionate. Recognizable syndrome. Skeletal dysplasia. Endocrine. Systemic causes. Variation in pubertal development. Delayed puberty. Precocious puberty. Premature délargé. Premature menarche. Premature drenarche. Adolescent gynecomastia, delayed puberty, constitutional hypogonadotrophic hypogonadism. Hypergonadotrophic hypogonadism. Hypogonadotrophic hypogonadism. Isolated deficiency. Mile per hour deficiency. PWS, LMP. Hypothyroidism. CNS tumors. Anorexia, increased physical activity. Hypergonadotrophic hypogonadism. Klinefelters. Anorchia/cryptorchidism. Turner's. Other forms of primary testicular/ovarian failure. 20 in zygonatal Sexual precocity complete, true, precocious. Incomplete precocious puberty. Complete precocious puberty. Constitutional. Idiopathic. CNS disorder. Severe hypothyroidism. Following androgen exposure, CA. Incomplete precocious puberty, 1. Males. Gonadotrophin secreting tumors. Excessive androgen production. Premature maturation of Leydig cells/germinal cells, incomplete precocious puberty, 2. Females. Ovarian cysts. Estrogen secreting neoplasms. Secondary to exogenous gonadotrophin or exposure to sex steroids. MCQ Albright. Treatment of sexual precocity. Depends on GnRH dependent true or central precocious puberty. GnRH agonists. GnRH independent and complete sexual precocity. Medroxyprogesterone acetate. Testosterone. Ketoconazole. Cypertone acetate, variation in pubertal development. Delayed puberty. Precocious puberty. Premature LRJ. Premature menarche. Premature drenarche. Adolescent gynecomastia, basic steps in growth assessment. Measure the height. Assess puberty. Parental height and calculate mile per hour. Compare child's height with mile per hour. Remeasure child's height after period of time. Calculate present growth velocity. If abnormally slow or rapid equals investigate. Case scenario 1. Paul is 8 years old and always shorter than his peers. Healthy but teased. Parents ask. Can't you give him something to make him grow better? Mother equals 166 centimeters. Father equals 169 centimeters. Mother's parents. Father's parent. 150 and 160 centimeters. Father's parent. 155 and 160 centimeters. Physical exam, N. Bone age equals 7.5 years. Testis equals 2 mls. Diagnosis? Case scenario 2. Stephen is 14.5 years. Hardly grown at all during the last year. Almost all are taller than him currently. Father equals 173. Mother equals 171. Father had late puberty. Physical exam equals N. No pubertal development. BAE equals 10 years. Blood is equals N. LHRH shows not yet in puberty. Diagnosis? Any treatment.